Hey everyone, welcome back for week 7 of child development. So, this week we're going to be finishing up objective 3.03, which is to understand components of a healthy pregnancy and delivery. So, we've already talked about a healthy pregnancy. Last week we started a little bit also about delivery, and today, this week, we're going to be finishing up the delivery process. So, what types of childbirth delivery options are available right now? Does anybody know? Good. So there are all sorts of different options available to parents now that weren't available several centuries ago. So those delivery options include natural unassisted childbirth, natural assisted childbirth, delivery by C-section, and then of course parents have a big selection of different locations. They can have a delivery at home, you can have it in a birthing center, you can have it in the hospital, and then of course there are different things that can be done in order to help the mother while she's in labor. They can include giving medication so that the labor process and delivery is a lot less painful, a little bit smoother for the mother and for the partner. If they use some different techniques, we'll talk about those, different breathing techniques, different strategies that they can learn before the delivery of the baby. Some of those include things like Lamaze and the Bradley method. Those are two of the most common classes that parents can take. So there's some risks and some benefits for each of the delivery methods that the parents need to weigh before they actually decide what they want to do. And in this week's lesson, we have a chart that would be a great resource for expecting parents to use to kind of decide, what are the advantages, what are the disadvantages for all of the different options that are currently available. So nearly 4 million babies are born in the U.S. every year. Childbirth care in the United States is very good. Less than 600 women die annually, so that's every year, due to complications during childbirth. Compared to in the past, those odds are very good for women in the United States right now. So let's talk about something. Is childbirth painful? What do you think? So I'm sure everyone has heard different stories, maybe from their mother, their grandmother, an aunt, a cousin, a friend, or some sort of relative in their family about that woman's childbirth experience. So every woman's experience is unique. Nobody has the very same exact experience. So some would say yes, that it's very painful, and a lot of women have told me no. In my time, said no, it was not painful at all. So, however, it is a short-lived experience, and there are many types and methods to effectively reduce the intensity of childbirth pain. There are many choices in childbirth, as we've talked about, and we're getting ready to explore those. Women can choose methods that make them the most comfortable, that makes the most sense for their personal and for their medical situation. So we talked a little bit about that when we were talking about a healthy pregnancy. Everyone's medical history is different, so if you have certain conditions, your childbirth experience and maybe the situations that you choose will be different than somebody else. So let's talk about natural childbirth methods that are available at home. So most women nowadays don't have childbirth at home, but this was a very popular and a lot of times the only option available up until recent times. So natural childbirth at home was normal, and it was the only childbirth delivery option until just 75 years ago. That's not very long. My mother, for instance, my grandmother, she had my mother and her two siblings all at home. because that was the only option that was available to her at that time. At that time, people didn't go to the hospital and have a baby like we do now. A lot of women do that, and a lot of women choose to do that for good reasons. So, natural childbirth emphasizes an unrushed, supported process with minimal interference. It's less invasive. There's no monitoring at the hospital. A lot of times you'll see women are hooked up to monitors to monitor their blood pressure, to monitor their contractions, to monitor the baby's heart rate. At home, you don't have that. You also don't have medical professionals running in and out of the room, so there's less interference from people that way as well. So there's a number of different childbirth classes that someone can choose if they're trying to have a natural, unassisted childbirth. In those classes, women and men can learn about the different stages of labor, breathing, different relaxation techniques, and what happens to the vagina after childbirth, and how to be prepared for the delivery and the new baby that you're going to be caring for. So what is a vaginal delivery with no medication? So a vaginal birth without medication benefits both the mother and the baby. There is some research that suggests the development of infant microbe is associated with the likelihood of developing allergic reactions or allergic diseases during childhood, but the association isn't clear. So they still have some research to do about that. So let's look at some of the benefits of a vaginal delivery. So first, the infants are born vaginally, and they tend to have fewer respiratory problems. Some other benefits include a quicker recovery, both for the mother, because they're avoiding abdominal surgery, such as if someone were to have a C-section, a cesarean section, there's different risks that come from that because that's an abdominal surgery. They're actually cutting into your abdomen, and there's risks for infection. Also, a vaginal childbirth has a lower infection rate and a shorter hospital stay. Because like I said, they're not cutting into your abdomen as they would if you were having a C-section. So some of the disadvantages are sometimes women can tear their perineum. Sometimes the vaginal birth may not be recommended for different medical reasons. An aunt of mine had a breech baby. So instead of the baby being head down, like they're supposed to be for a vaginal delivery, the baby was feet down, which makes a vaginal delivery a whole lot more complicated and risky. So for her, they suggested, since the baby didn't turn, to have a cesarean section instead for medical reasons. So what about a home birth? So right now, only about 2% of women in the U.S. actually go for the home birth instead of going to a birthing center or a hospital. Some of the advantages are that it can be safe and relaxing to have a natural childbirth delivery with a low-risk pregnancy. Home births are vaginal deliveries with no medication. A variety of different mind-body techniques and preparation methods are used to reduce the childbirth pain instead and promote an easy and effective labor and delivery process. So home births are actually attended by either a midwife or a certified midwife or a licensed nurse midwife. Sometimes people will ask for a professional support person like a doula to attend a home birth, and these are all different professionals, birthing professionals, that work with birthing centers to help women have deliveries at home. So what are some of the benefits? So a lot of women find that having a home birth is very relaxing and comforting because they're in their own home, and that's where most people feel the most comfortable. Another thing is they don't have to worry about being taken to the hospital while in labor, or being transported home after the delivery, because they're already home. Having the baby at home means having all of your comforts of home, including all of your snacks, all of your clothes. Nothing has to be packed up and taken to a hospital. So the recovery and the transition into breastfeeding can be easier for women because the environment is comfortable and it's familiar. When you go to a hospital, most people, that's not a common environment for people. So that can kind of hinder the breastfeeding process sometimes. A mother can invite whoever she wants to attend the birthing process. At a hospital or at a birthing center, a lot of times they'll have a limit. They might say, oh, you can only have one person or two people in the room. Right now, because of the coronavirus pandemic, a lot of hospitals are not allowing any visitors into the hospital. So that includes if a woman is pregnant and getting ready to deliver a baby, her spouse, or her mother, or whoever she chooses to be in that birthing room with her is no longer being allowed to be there for safety concerns. So many women feel more comfortable having a home birth, also because if they need to if they need to yell, if they need to scream, if they need to vocalize themselves through the childbirth process and through the pain that they're having, they're in their own home. They're not in a hospital. They don't have to worry about anyone hearing or anything like that. So let's look at some of the disadvantages of a home birth. So if you're doing something like a water birth, which is usually like in a tub, or sometimes people will buy like an inflatable pool or something to put in their house, that will need to be brought into the home and prepared in advance. If the home is very remote or if the weather is bad, it may be difficult for a midwife to reach them at home in time. I know that a lot of times we see movies where the woman's water will break and she'll have a contraction, and then all of a sudden they're rushing to the hospital because the baby's getting ready to be born. And although some women have very, very short birthing processes, a lot of women it takes more time than that. And that becomes especially apparent when this is the woman's first child, because the body has not been through that process yet, compared to the woman's third or maybe fourth pregnancy where the body has been through it. And a lot of times you'll hear women say, it took, a day or 2 days for the first one, and then for my third or fourth child, it just took a couple of hours. So depending on what is the mother's timeline, that could be a disadvantage to the home birth, is not having enough time for that professional that you have hired or asked to be there to come in and assist through the process. Another disadvantage would be, what if something happens? So what if there's some complications, which can never be expected? A lot of times, just because you had one pregnancy and delivery that was fine, you never know what could happen. So this would be a disadvantage of the home birth, because usually, if it doesn't progress normally, then there would need to be a change in plans, and there would have to be some sort of transportation made in order to get that woman to the hospital to deliver the baby with medical assistance. Some women are not comfortable with a home birth, and that's not a good option unless the pregnancy is low risk and the mother prefers it. So let's look at some other different things. So what is the Lamaze method? Has anybody ever heard of Lamaze? So the Lamaze method is typically known for controlled breathing techniques, and it includes a number of comfort strategies that can be used during labor. So different breathing techniques are used to increase the relaxation and decrease the perception of pain. In addition to just breathing, there's other information about preparing for childbirth that's covered if you take a Lamaze class. Lamaze is taught in a series of different classes that can be attended both by the mom and by the partner, the dad, or the spouse, whenever possible. The Lamaze method doesn't explicitly encourage or discourage medication, but it seeks to educate women about the options so they can make a birth plan that suits their individual need. So let's look at some of the benefits of Lamaze. So Lamaze training prepares the mother and her partner with a number of tools to use to get through the labor and delivery naturally. Breathing, relaxation techniques, those things help reduce the perception of pain inside of the mother during the labor process, and it kind of helps the labor move more smoothly. If you're in pain, and this is not just specifically to labor and delivery, but if you're in pain, you get anxious, you get tense, you get stressed, you get worried, and when you're in labor, that doesn't help. That kind of hinders the process. So let's look at some of the disadvantages. Learning Lamaze, it takes time. There's several different classes, and the couple must plan ahead and kind of work those classes in, starting usually about the second trimester. This is not something that you can just kind of go in one day for 30 minutes and learn and come back out. This is a series of classes that a woman and her partner take. So now let's talk about the Bradley method a little bit. The Bradley method focuses on preparing the mother for natural childbirth, coached by her partner. So that would be, her spouse or the father or whoever her partner is. It emphasizes on being prepared for unassisted vaginal birth without medication. The method is taught over a 12-week long period. Midwives often recommend the Bradley method. In addition to learning ways to reduce vaginal pain during vaginal birth, the method teaches about nutrition and also about different aspects of health. So some of the benefits of the Bradley method include that it helps prepare someone, prepare the mother and the father for unassisted birth. It helps a couple be prepared with techniques to reduce the perception of pain, to stay relaxed and calm through natural, unassisted, and unmedicated childbirth. It also teaches the couple things that they need to know to take care of themselves as new parents and what to expect when the baby arrives. So some of the disadvantages is for couples who are uncertain if they want to try unassisted vaginal birth without medication, the Bradley method might not be the best for them. The course and training takes quite some time, usually about over 12 weeks, and the couple needs to begin classes as soon as the second trimester begins. So then we talked about the water birth at home. They also have different birthing centers now that have water births available to expecting mothers. So a water birth just simply means that the mother goes through some time or all of the stages of childbirth in a portable tub, kind of similar to like a hot tub. The baby can be delivered either underwater, or the mother can get out of the water and deliver in a different position if she wants to or needs to. Women choose water births because it can be more relaxing, less painful to be in the water, and birthing tubs can be brought into a home for a home birth. This doesn't have to be something that you go to a hospital or a birthing center to do. This can be right in your own home. And they're often, like I said, also found in birthing centers, and some hospitals might have them too. So let's look at some of the advantages. Water birth is thought to be less painful. The mother is more relaxed, so that kind of helps with pain. Give me 1 minute, y'all. All right. And also, sometimes I've seen where the partner can also get into the tub and be with the mother to support the delivery process if they choose to. So some of the disadvantages is some critics say that water births can actually increase the risk of infection, but as long as the water is fresh and clean, water births are not any more riskier than non-water births. Unless the water birth takes place in a birthing center with an established tub, the logistics often involved in getting set up, as far as the tub and warming the water and getting the water ready for birth, can be a disadvantage because that's something that you have to prepare for ahead of time. If the birth plan at home does not progress normally, like we've talked about with many of the other home methods, then of course now all of a sudden you have to require transport to the hospital. You have to get that ready, and depending on how far you are from a hospital, like here where I don't live anywhere near a hospital, so it would take me at least 30 minutes to get to a hospital. So that can be a disadvantage for someone who may run into a situation where they become medically critical and need care immediately. So let's look at the different types of benefits to a hospital delivery. So, like we talked about, there's readily available access to emergency medical interventions, such as, let's just say, a C-section, a cesarean section, if that were to become necessary. So another thing would be advanced monitoring for high-risk pregnancies. My second child was a high-risk pregnancy. My water broke almost 2 months early with him. So at that point, I was a high-risk pregnancy already to begin with, and then having that on top of it, where the baby was going to be born 2 months premature because there was no stopping it once my water broke, that would be a benefit of me having a hospital delivery. At that time, it was time for me to go to the hospital because I was no longer a low-risk pregnancy. Also, with the hospital delivery, you have more pain management options, including like an epidural or different IV medications that they can give you to reduce the pain and kind of help the ease of the delivery. So some of the disadvantages to a hospital delivery include the risk of the hospital delivery having a higher chance of unwanted interventions. So what does that mean? So I had all 3 of my children at a hospital, in and out all day. When I was there, were nurses, different doctors coming in. So they're monitoring you and they're telling you, you have to do this, this needs to happen, where at home you don't have that. So the unwanted intervention can sometimes be a little bit of a disadvantage. Sometimes the hospital setting can lead to rushing through the stages of labor. That results in a higher chance of having an incision or having a C-section. If your delivery is taking too long and the doctor's worried, since the baby has now been in the birth canal for several hours, they can kind of, tell you, hey, well, now it's time, we need to do a C-section. Which, sometimes can be very helpful because, like I said, at home, there's no monitoring. So you don't know if that baby is in distress. And at the hospital, they can hook monitors up to the baby while you're going through the delivery process to monitor the baby's heartbeat and to see if that baby is in distress and needs to be have an emergency delivery via cesarean section. So some of the other risks include a higher chance of infection. Anytime you're at the hospital, that's always a risk. So now what are some assisted births? So natural births are not always an option. And if a complication develops, then women have a number of options to assist them into a safe birth. Sometimes a C-section is planned in advance, and sometimes it's not. Sometimes it becomes an emergency and a medical decision that needs to be made in order to save the life of either the mother or the baby or both. So, a C-section, according to the CDC, 1/3 of births are delivered by a C-section, although rates are highly variable by hospital in different regions. The World Health Organization says that the rate of C-section delivery should be about 10 to 15% higher, because they can be both elective in the United States versus just simply an emergency reason. So a C-section involves making a horizontal incision across the abdomen, across the lower part of the abdomen, which to the infant, the baby, is delivered. The typical hospital stay is usually about 3 days to ensure that the cesarean incision is healing properly. Full recovery, though, takes 8 weeks. So one advantage of the C-section is the delivery date can be planned ahead. Next, we're going to talk about vacuum extraction. So a vacuum assisted delivery involves attaching a soft cup to the head of the infant while they're in the birth canal, and a hand pump is used to create a suction to facilitate the delivery of the baby. So an advantage with that is that there's a lower risk of a C-section, and like we talked about, if the baby is in fetal distress and they're in fetal distress for a prolonged amount of time, that can increase the risk of complications, anything from injury to death. So when they use a vacuum extraction, if it's successful, then that decreases the risk of having to cut the mother open and do a cesarean section. So some of the risks with this method include scalp injuries. So because they're attaching that soft suction cup to their head, they can get minor injuries to their scalp, and sometimes it can lead to serious trauma or bleeding of the head, depending on how that vacuum extraction is being performed. So another option is forceps. So forceps assisted delivery means that a curved instrument is used to facilitate the progress of the infant through the birth canal. So it kind of helps the infant go through the birth canal when the mother is not able to, or if they need to get that baby out quicker than what the mother is able to do. So forceps cannot be used, if the infant is breech. So if the head is not down, if the baby is breech and the feet are down instead of the head, then that option is off the table. And there's other things that the doctor can do at that time. All right, so that is it for our different childbirth delivery methods and different options. And I just want to say that next week, Miss Warren will be taking over all of the classes. So this will be my last week with y'all, since I will be graduating from ECU. So I want to thank y'all for having me in the classroom and being good to me, and I hope that you have had a good experience, and I hope to see you next year.